I have realized that students often struggle when defining or when asked to define some terminologies in pharmacology. Therefore, this video will be the first of a series of short videos that is designed to address this situation. In this particular video, I'm going to talk about the definitions of some important terminologies in pharmacokinetics and pharmacodynamics. And because I want the video to be really short, as much as possible, I will avoid any long explanation. In most instances, I will just define the terminology and move on to the next one. So the first one is Cmax. Cmax is the maximum plasma concentration achieved by a drug. Tmax, on the other hand, is the time taken to reach that maximum concentration. Bioavailability is a fraction of an administered dose of a drug that reaches the systemic circulation. And we know that bioavailability is particularly important for drugs that are administered via the oral route because those drugs have to pass through a lot of barriers before entering the systemic circulation. Therefore, factors like first pass metabolism, uh, like factors that affect absorption, all can contribute to the degree of bioavailability of a drug that is administered orally. And bioavailability is important because a drug that has a high oral bioavailability reduces the amount of drug to be administered to achieve the desired pharmacologic effect of that drug. And also, this will reduce the rate of side effects and toxicity of that drug. So, if the bioavailability is high, then we know that the dose to be administered or the amount of drug to be administered will be uh, will be lower also. Half time is the time required for a drug concentration to decrease by one half. Bioequivalence. Two drugs are said to be bioequivalent when the rates and extent of bioavailability of the active ingredient in the two products are not significantly different under suitable test conditions. Differences in bioavailability between different formulations of a particular drug can have clinical significance. Therefore, it is important to know whether drug formulations are equivalent. It is particularly important when switching from a generic drug to a brand name drug. First order kinetics simply means that the rate of reaction is directly proportional to the concentration of the drug, that is linear kinetics. Zero order kinetics, the rate is independent of the concentration of the drugs undergoing reaction. That is, the rate of reaction cannot be increased further by increasing drug concentration. For clearance is the volume of plasma from which the drug is completely removed per unit time. And mathematically, clearance is rate of elimination divided by plasma concentration of the drug. First pass effect. This is the metabolism of a drug in the gastrointestinal tract after absorption and also during its first passage through the liver before reaching the systemic circulation. Absorption is the movement of drug from a site of administration into the central compartment. Enteric coating. This is use of acid-resistant coating for a drug, and it's important for drugs that can be destroyed by gastric juice or by drugs that can cause gastric irritation. Controlled released drugs. These are drugs whose particles are coated with slowly dissolving material. Then drug distribution. This is the movement of drugs into interstitial and intracellular fluids. Volume of distribution is the volume that will accommodate all the drug in the body if the concentration throughout was the same as in plasma. And the formula for that is V equals dose administered divided by the plasma concentration. Metabolism is a series of processes that converts drugs and xenobiotics into water-soluble and easily excretable products in the body. Loading dose. This is a single or few quickly repeated doses given in the beginning to attain target concentration at to achieve to attain target concentration rapidly. Maintenance dose. This is the dose of drug that is to be repeated at specified intervals after the attainment of target concentration so as to maintain the same concentration by balancing elimination. Receptors are macromolecular components of the organism with which the drug interacts to initiate the biochemical and physiological changes characteristic of the response to the drug. Agonists. Drugs that bind to physiological receptors to mimic the regulatory effects of the endogenous signaling compounds are called agonists. And antagonists, on the other hand, are drugs that bind to receptors but have no stimulatory effects, but rather inhibit the action of an agonist. Partial agonists are agents that activate a receptor to produce a submaximal effect, whereas inverse agonists are drugs that activate receptors to produce an effect in the opposite direction to that of the agonist, or stabilizes the receptor in its inactive form. Drug affinity. This is the strength of the reversible interaction between a drug and its receptor, or put simply, it is the ability of a drug to bind a receptor. Intrinsic activity is the capacity of the drug to induce a functional change in the receptor. G-protein coupled receptors. These are a family of cell membrane receptors that are linked to effectors through any of the guanosine triphosphate activated proteins. Second messengers are molecules, enzymes, and other biochemical components that generate, amplify, coordinate, and terminate post-receptor signaling. They initiate cellular signaling through specific biochemical pathways. Supersensitivity is increased responsiveness to agonists and results from chronic reduction of receptor stimulation. Tachyphylaxis is rapidly developing tolerance to the effects of a drug after a single exposure. Drug potency, this refers to the amount or dose of a drug that is needed to produce a certain response. Efficacy, on the other hand, refers to the maximal response that can be elicited by the drug. LD50, liter dose 50, is the dose of a drug that is required to kill 50% of the test subjects that have been administered that dose, and is a measure for expressing and comparing the toxicity of drugs and chemicals. Efficacy dose 50, on the other hand, is the dose of a drug that will produce a specified effect in 50% of the test population that have been administered that dose. Efficacy dose 50 should be considerably less than LD50 for any particular medication. It is derived from a dose response curve, and it is important to avoid potential adverse effects in patients. Therapeutic index, on the other hand, is the ratio of the L50 of a drug to its ED50, or it can also be defined as the median liter dose divided by the median effective dose. Now, for therapeutic index, it's a measurement of the safety of chemicals, and the higher the value of the TI, the safer the drug is. If the TI is small, then the drug should be dosed carefully and the patient should be closely monitored for toxicity signs. So drugs with a low TI uh, that means they have a low safety margin. Synergism is the interaction between two or more drugs that causes the total effect of the drug to be greater than the sum of the individual effects of each drug when administered separately. An example is a combination of a beta-lactam antibiotic with an aminoglycoside. Additive effect, on the other hand, is a situation when the effects of a combination of two or more drugs equals the sum of the effects of the drugs acting independently, e.g., combination of acetaminophen with aspirin. Potentiation is a situation whereby one drug does not elicit a response on its own, but enhances the response of another drug, e.g., acepromazine increasing the analgesic effects of opioids. For tolerance, tolerance is decreased in response to a drug as a result of repeated administration. This is due to chronic receptor desensitization, and in tolerance, a higher dose is now required to produce a previous response that was being achieved or elicited by a lower dose or concentration of the drug. Thank you. I was hoping I could do this in less than 10 minutes, but I exceeded that time. Thank you. So later I'll produce another short slide to directed at defining some other terminologies. Bye.